It is great to welcome to the program Podiatrist Dr. Ed Singleton, one of the best foot and ankle specialists here in the North Texas area. He is the only guy minimally invasive procedures with tarsal tunnel syndrome. Also, what other minimally invasive procedures do you do, doctor?
There's a number of conditions that can be addressed with minimally invasive or minimal incision techniques. Hammer toes, that's where the toes are kind of all drawn up that are painful from rubbing on shoes. Some bunions can be done with minimally invasive techniques. Heel spurs and plantar fasciitis and heel pain is one that can easily be done with a minimally invasive technique. That involves a little incision, about 1/4 of an inch or maybe it's slightly bigger on either side of the heel. We use arthroscopic equipment or endoscopic equipment. So minimally invasive techniques are easy to apply to a large number of conditions affecting the foot, and some ankle conditions can be addressed that way as well.
All right, doctor, what are some of the most common fears, I guess, people when they come to see you, and how do you put them to ease?
A lot of the fears that people have about surgery comes from the fact they don't understand or know what's going to happen. And it's almost fun to sit and talk to patients and explain to them what the procedure involves, how it's done, and answer all the questions that they have.
All right, doctor, a lot of people experience foot and ankle problems. When should they come in? How long should they wait?
The pain that they have from walking around, that's a signal that you need to have something looked at. There's a problem. Let's say you have a painful bunion on the big toe joint, that the shoe rubs on it, turns red, and it gets angry looking and it hurts. The longer you wait, the more cartilage is worn out from that joint surface, and the bigger the procedure will have to be to fix the problem. And I say bigger, meaning more bone work, more joint repositioning work needs to be done. Sometimes it's too late and you have to either fuse that joint or put a joint implant into the big toe joint area. So the longer you wait, the bigger the procedure needs to be. And there's no reason to wait because you're hurting. Why hurt for so long?
There you go, Dr. Ed Singleton, podiatrist. He's the guy to see if you have foot and ankle problems. Dr. Ed Singleton providing pain freedom for your feet.